The Self-Care Learning and Discovery Series is back, and it's bigger and bolder than ever. This is the premier self-care event of the year, bringing together self-care enthusiasts of all backgrounds and disciplines from around the world. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. We also know that self-care means different things to different people. What does self-care mean to you? You'll have ample opportunity to reflect on this question during the Discovery Series, with more than 20 interactive virtual sessions organized by self-care experts worldwide. The Discovery Series will elevate cutting-edge research, programming, and advocacy insights across a wide variety of self-care topics, and we encourage you to attend as many sessions as possible, especially on topics that may be new to you. The Self-Care Learning and Discovery Series, a core activity of the Self-Care Trailblazer Group, is organized by the White Ribbon Alliance in partnership with co-sponsor organizations and esteemed steering committee members. We also want to thank all our session organizers and presenters who have voluntarily dedicated their time to curate this event with us. We are pleased to share that every session will offer live, simultaneous interpretation in French, Spanish, and English. To access the interpretation, simply navigate to your meeting controls located at the bottom of your screen. Click on the globe icon labeled Interpretation and select the language you'd like to hear. Joining from your phone, tap on the ellipses to find the interpretation feature and then select your language. Please note, you can switch languages at any time throughout the presentation. The session is now about to begin. Don't forget, whether you're working to influence policies or programs, advance universal health coverage, or improve your own self-care, we hope that you will take the learnings from today's discussion and apply it to your own work. To that end, we invite you to continue the conversation and take action with us by becoming a member of the Self-Care Trailblazer Group. So get curious, jump in, and share your ideas and insights with us. We look forward to advancing self-care together.
Good afternoon, everyone. Good day wherever you are. Some of us probably listening from Kenya, others in Africa, other people from different places. And so we want to welcome you today. This is quite an exciting session. I can guarantee that you're going to walk feeling that you have gotten something of great quality. And so just to give us an overview, Grassroots Soccer has partnered with LVCT Health in Kenya to implement a sport-based curriculum for mental health. At this point, the curriculum has been between the years 10 to 14, and it's been 50-50% in terms of girls and boys, so that no one has been left behind. And so we have been through the first cohort. Ideally, MindSKILLZ is a 12-session curriculum. It's been very exciting for the young people to go through the 12 sessions. And so we have already seen one of the cohorts go through, and we cannot hide our excitement about the things that we've been able to see. So welcome as we get to hear our journey. Welcome to this session. We are going to be having a team, and just again, we are co-hosting this together with Grassroots Soccer and LVCT Health. So we are going to be getting to our first speaker shortly. But then before we get to that speaker, I would want to acknowledge some of the people who have been part of us. I would want to talk about the government of Kenya, Ministry of Health, where both the counties of Mombasa and Nairobi have supported us tremendously to make this a success. And so a lot of the success that we've been able to get includes the government of Kenya, which has been supporting these efforts greatly. And so we have quite a number of panelists people who are going to be presenting with me. We have Charmaine, we have Zekia. We'd also be having two coaches who have actually been in the field, giving knowledge and facilitating the sessions. And so it's going to be exciting as we get to hear how it has gone for them, as we get to hear their lessons that they have been able to learn, as well as what are some of the things that probably, if you are implementing MindSKILLZ, what are some of those things that you'll be able to check out for. We will be having Zekia and Magero, who are actually coaches. We have quite a team. We have also Stella, who is with LVCT, and quite a number of team which is working behind the scenes to make this a success. And so thank you so much. And so once again, give me this great opportunity to welcome Charmaine Nyakonda. Charmaine Nyakonda is going to be giving us a brief background, and as well as being the first speaker. And so kindly allow me to welcome to this virtual stage, Charmaine Nyakonda.
Thank you very much, Benjamin. Welcome, everyone. I'll be taking you through a brief overview of grassroots soccer, which I'll be referring to as GRS sometimes, and our adolescent mental health strategy and our mental health programming, particularly our MindSKILLZ mental health program that is being implemented in Kenya at the moment. And there will be a lot of interactive activities going on. So there will be a few poll sessions coming up for everybody to answer a few questions here and there. But before I start off, I'd really like to send a great appreciation for everybody for signing up for this session, and particularly our global partnerships manager, who is here today as well, who has made our work with Kenya a great success, and a lot of the other team members from both Grassroots Soccer and LVCT Health who are here as well attending the session. Next slide, please. So Grassroots Soccer is an adolescent health organization that leverages the power of soccer to equip young people with life-saving information and services, particularly in ways that speak the type of language that young people like to hear, that speak to young people in fun ways so that they get to hear and learn health information, and also to give them a type of experiential and exciting learning that allows them to both learn and have fun and engage with other young people as well. Next slide, please. So please answer the following 2 questions in the poll question that's going to pop up in your screens. So I'll give everybody about 20 seconds to answer the 2 poll questions. Great. We will be sharing the results of the poll. Very exciting to see a wide range of answers and an interesting range of answers for the first one, which says, true or false, adolescents experience mental health challenges. And yes, that is true. Adolescents do experience mental health challenges. Next slide, please. Our slide here has the answer to the second question as a part of the layering of what the problem looks like in sub-Saharan Africa. So the extent of the problem in sub-Saharan Africa in terms of mental health has multiple layers, where the first part of the layer is that poor mental health is a critical health issue, where poor mental health is a #1 cause of disability among young people. And then to add on to that layer as well, where sub-Saharan Africa has the highest rates of mental health disorders. And then the second kind of layer to that problem becomes that, is the right answer is that 75% of mental health disorders have an onset by 24, where 50% have an onset by 14. So you have this 14 to 24-year-old age range, which makes adolescence this perfect time to intervene with mental health promotion and prevention, particularly where early detection and interventions are essential in making sure that crises and traumas do not translate into permanent chronic mental health challenges for young people. And then the last critical part of the problem that layers and is the final seal to this problem is that treatments for mental health tend to be scarce in supply in sub-Saharan Africa, where 90% of adolescents in sub-Saharan Africa never receive the care that they actually need, which again brings us back to this idea that promotion and prevention is the right way to go, because not only is it cost effective, but it also targets the right timing and the right window of opportunity to intervene to make sure that there is a change in adolescents so that they practice and have these lifelong healthy behaviors. Next slide, please. So a poll question is going to pop up again. Please input your answers for this question. Thank you for your answers. We're going to share the results of the poll, but we have an overwhelming response for true, which is very much accurate and speaks to the next part of our presentation. Next slide, please. So you find that from this quote, which came from a participant from our HIV Skills Plus programming that focuses on HIV information and skills around getting tested early, etc., that a lot of HIV positive youth had suffered from depression, and it was really hard for them to get help for their mental health problems because everyone was so focused on their HIV status, and everybody was treating them as their HIV status and less as a person. And so there was this big emphasis of this relationship and this impact that mental health has on other healthcare issues, including HIV, including health-seeking behaviors in other areas as well. Next slide, please. So Grassroots Soccer's mental health solution really focuses on ensuring that we're able to help participants with our curricula and programs to develop a resilient mind, which is definitely very crucial during adolescence, and also focus on equipping participants with the critical knowledge that they need to maintain a healthy body, because you need that healthy body to fuel a healthy mind. And then we also, in our programming and curricula with working with young people, really focus on helping participants to build this strong support network that they need for when those challenges arise, that they are then able to better cope with those. Next slide, please. Our mental health programming and package is essentially built around the World Health Organization's intervention pyramid, which essentially is the global standard for effective mental health program, where our primary focus is on lower levels of care, as you can see from our pyramid, where we aim to ensure that our mental health programming provides the basic psychosocial support needed, promotes positive mental health, builds psychological supports, and in cases where we are not able to provide the type of specialty and services needed, we then refer to specialized mental health care and to psychiatrists and psychologists and other mental health professionals who can best provide that additional care. Next slide. So our mental health programs are in multiple forms. Under the basic psychosocial support program, under the basic psychosocial support part of the pyramid, we have skills program integration. So for a long time, for over 20 years, we had already been working with young people and keeping them with skills around HIV and SRHR. So when we launched our mental health strategy into 2022, what we did was integrate mental health and mental health content into all our skills curricula that focus on other different health areas to make sure that on the base level as well, that young people are getting access to information around mental health. And then the second aspect of our mental health programs that falls under the part of promotion of positive mental health part of the pyramid then focuses on our MindSKILLZ curricula, which is a face-to-face 12-session youth mental health curricula that's delivered by near-peer non-specialists in schools and communities. And in Kenya, it's adapted for Kenya and available in English and Kiswahili. And this MindSKILLZ curricula that we have, that is conducted face-to-face, its themes promote mental health knowledge, substance use education, coping skills, self-esteem, social connection, safe spaces, and mental health care. And MindSKILLZ is really GRS's first sports-based skills program, 100% and standalone, dedicated to mental health, and is guided by global standards from World Health Organization Mental Health Action Plan and the UNICEF Global Multisectorial Framework and UNICEF's Helping Adolescents Thrive Toolkit. And this curriculum is not only delivered on its own, but it's also delivered with a supplementary tool called our MindSKILLZ magazine, which I'll touch on later, that also participants get to take home with them and share with their friends and spark conversations in the community around mental health. And then we also have our caring coaches, our near peers, our skills coaches who deliver mental health curricula. And under the layer of psychological support, we do have programming in Zambia with our partners there, where they're delivering group therapy to participants who fit a specific threshold to show that they're exhibiting specific symptoms that may result in either depression or anxiety. And for our caring coaches as well, we have this MindSKILLZ training manual that really trains them to deliver the MindSKILLZ curricula and to be the types of caring coaches that they are and to be people that participants look up to. And then the last aspect really being having these great systems in place with our partners and our direct implementers to identify and refer any participants that require specialized care that we may not be able to provide them with. Next slide, please. So another poll question will appear. Please do provide your responses. Thank you. We will be sharing the results of the poll. An overwhelming response to fact. So this fact or nonsense type of poll question is an example of the type of session practices that our coaches deliver with participants, where there is a range of fact nonsense questions that are asked to participants, and participants get to say whether something is a fact or whether it's nonsense, and then different types of groupings of participants who either said fact or nonsense then share their reasoning behind that, and then they discuss with their caring coach why something is either a fact or why something is either nonsense, to really get at the nitty-gritties of starting these conversations with 13 to 14 to 15-year-olds, to really understanding how they're thinking about certain questions around mental health and around other areas that are incorporated into our practices in our MindSKILLZ curricula. Next slide, please. You will be receiving a link in the chat to a Jamboard where you will provide your responses to the current question that you're seeing on your slides, which is asking you to share on the Jamboard what is one healthy activity that you use to reduce stress. The Jamboard link has been shared with everybody. So when you do access Jamboard, you can just quickly add to text and write down your responses to the question. We're seeing go for a walk. That is a very nice thing to do. Nice breeze, nice refreshing walk. Good time to think about life. Exercise, dance, various range of things that people are doing. Go for a jog, dance. Sleep with no distractions, phone on silent. That's a very resilient response. Not that many people are able to put their phones away when they go to bed. Exercising, talking about the stress with somebody you trust. That sounds like a definite good thing to have. So while everybody is completing the Jamboard and sharing all the types of different activities that you use to reduce stress, I'm going to hand it over to one of our coaches to just take you through an activity called Power Hand that we usually take participants through. That speaks to something one can do to cope with stress and reduce stress. Next slide, please, and then also handing it over to Zakia for the Power Hand activity.
Hi everyone. So I think I'll just delve into it because Shamin has already mentioned something to do with the curriculum that we use as coaches. So now that we are from the screen, we are able to see the Power Hand, one of the activities that is part of the intervention. So from the Power Hand, probably from power, we get to understand something to do with strength. And for strength, in MindSKILLZ, when you talk about strength, we talk about being able to face difficult situations, being able to stand up for yourself, and being able to be yourself at difficult times, and also getting to bounce on how you can bounce back. So in this activity, I would probably request if you're near a piece of paper and probably a pen, because it will be more of you doing it on your own, and not only will I be speaking of it. So if you're able to access a paper or a book and a pen, for this case, you'll have to draw out your hand and being able to just reflect on the things that we can use whenever we are having difficult situations. So before we start, we think of even drawing anything. First of all, I'd like to guide us on how we go about it whenever we are having the sessions with adolescents. And so we first of all get to understand what is self-knowledge. So getting to know what self-knowledge means, it's more of getting to understand who you are, and with that, having a self-talk with yourself and with yourself, and probably within you, within your space, you will be able to get to identify some of the things that are happening from within, probably things that you know about yourself and you've never known, or rather things that people know about you, they've mentioned to you. So with the Power Hand, we will be able to, first of all, get to identify a number of strengths that we know about ourselves within the practice. And therefore, as you can see from the screen, it is more of your hand. And with me, I have already done mine, and I can easily display. So this is it, as you can see. So this is the hand itself. So whenever you're sketching your hand, make sure you're in a space where you feel comfortable, and probably getting to understand why you're doing that. So with that done, probably I would also request, if you've already sketched your hand, you can easily identify 5 major strengths that are within you, and one of them being a personality trait that you think you know about yourself, and what you know works with you, works for you, and works for the people around you also. And probably you could also identify an ability that you as well identify with, and also a skill that probably you know you are perfect at, and you can also support one another or support someone else when it comes to establishing how they can go about it. So with that done, we can also, from the practice, whenever we are having a session, we are able to now that you are now our participants, you will be able to like have your strengths, the 5 strengths on each finger. So after identifying the strength that you identify with, then you can quickly just go through them, and now we can see on how we can become more resilient when it comes to identifying, or rather getting more comfortable with our strengths. So in this case, at this point, we usually, and I would advise us to just find a space, or rather sit in a manner that you feel comfortable, and have your hand on the paper, or rather have your hand with you. And probably for those who are not in a position to have already sketched their hand, they can identify the strengths and just have their hands with them. And we can close our eyes for us to see and get to understand or identify and think of the strengths that we have within us, in terms of getting to make them personal to us, and getting to understand it is what the strengths themselves are, the things that define who we are. So we can have our hands, for those who don't have the pieces of paper, and then as you have your hand, you can close your eyes, and being that you're in a comfortable space, sitting upright, then you can, for my case, I had already done mine, but for the purpose of those who are not in a position to have their papers with them right now and pens, you can identify, like, if it's for me, it's more of, I am a footballer. That's an ability, that's a skill that I have. So I would close my eyes, I lead the group, and I would lead them in terms of just going up as you breathe in. So you'll breathe in for 4 seconds. As you go up, your finger, you're sketching the finger, the thumb, you sketch your thumb. As you sketch your thumb, you go all the way up to the top, and then you pinch it just to identify the strength that you identify with. Now that I am a footballer, I use the footballer. I am a footballer, I tell myself. And with that, I go down as I breathe out, as I count for myself for 4 seconds, slowly. The same applies to the index finger. So you will do the one strength with the entire, your hand, the batch of fingers that you have, the 5 fingers. So as you continue, you'll be able to do one strength, one hand. And then once you're done with the strength itself, then you can have, because there were 5 that you had identified, you can support yourself and find a space and continue doing the rest. Like if you're a critical thinker, you can do, you can start again from the thumb. You go upwards for 4 seconds as you count slowly. And then when you reach at the top, you pinch it while stating the strength that you know about yourself. And with that, we can be able to identify, and with it, we can be able to become more resilient when it comes to facing some of the difficult situations that we face in life. And as for an adolescent, it is very essential for them to have identified the strength, because more so, when you're having self-talk, we get to talk about both negative and positive things about ourselves. And with that in mind, we are able to identify, or rather, get ourselves comfortable with the positive things about ourselves. And that is why we ensure we foster good thoughts, good memories that will enable them identify the strengths that are within them. So essentially, our intention for you to have identified the strength, it means that you are in a position to withstand any difficult situation, any difficult moment. And with that in mind, you get to understand that you also matter in life, and nothing else should put you down, or rather, no one should put you down because of something that you're not good at. So with that in mind, we are able to also support and get support. Now that we know our strengths, we can get support from trusted individuals within our spaces, within our homes. For adolescents, also they get to identify with their parents, teachers, and peers within the same age group. So for us, we will get to identify probably with our colleagues at work and other people we trust. Then the most important thing about the practice on strength, where we use the power hand as an illustration to just identify the strengths that we identify with as individuals. It is important for us to understand that we matter, and it is important to know and identify some of the strengths that are within us, and with that we can be able to have good mental health, and above all get to have better outcomes when it comes to our daily activities. We can also learn through the breathing technique. So at your own free time, you can do it. Now that you've identified your strengths, you can do it in terms of identifying one strength, and then you breathing it out. Breathing in for 4 seconds. At the top of your finger, you pinch it, and then you go down as you breathe out for 4 seconds. The same applies to the rest of the fingers. Once you're done with one strength, you can be able to use the technique, or rather apply it at any point in time. So with that, we are able to support adolescents and get to ensure that whenever they need of support, whenever they need of self-realization, we are there to support them. And with that, we can be able to foster better citizens, better individuals in the society. With that, I'd like to take it back to the moderator, and then we can take it from there. Thank you.
Wow, I'm sure that has been quite interactive. I hope that you've been able to draw your fingers. I hope you've been able to see your strength. I hope you're smiling at yourself right now because you're realizing that you actually have strengths. And this has been one of the most liked activity by the young people. But, you know, this is just one of the many. And so keep tuned in as we share more. Now, Charmaine is back. Charmaine is going to be introducing to us the magazine, the MindSKILLZ magazine, which is a great, fantastic resource, which is designed to empower our participants on their self-care journey. Charmaine, take it away.
Next slide, please. So I'm active mental health resources for at-home learning, low tech. And the best part about our MindSKILLZ magazine is that they spark conversations also at home and in their communities when young people go back around mental health and around emotions, coping skills, balancing stress, and sections just for fun as well. And they also touch on other key topic areas such as peer pressure and choices and being responsible. Next slide, please. Another great thing about our MindSKILLZ magazine, as you can see, if you can see there where it says page 19, and it says build your team. There, essentially, the idea is to speak to young people about thinking about people who they can talk to when they're feeling low or sad or anxious in their communities. And instead of talking about it in medical terms or in psychological terms, etc., instead of saying, you know, who do you go to talk to when you're feeling sad or down, we say build your team, because we know that that idea around team, around the power that a team brings, around the passion, around knowing that someone is your teammate and not just a supporter, really brings the message home about building those strong support networks. So really a key thing in our magazine and our curricula is using the type of language and the type of fun language and the type of metaphorical language that brings the message home for young people in ways that conventional, clinical, and psychological terms wouldn't otherwise do. Next page, please. Next slide, please. So as you can see as well, that in our MindSKILLZ magazine, we have messages for parents and guidance. We have the power hand as well for young people to take home and teach to their communities, to their friends. And we found that, one participant takes a MindSKILLZ magazine home and it reaches a whole lot more other people through these young people sharing the magazine, sharing the lessons in the magazine, and in their excitement of sending through the message in ways and words that are more familiar to them and more acceptable to them. Next slide, please. So our highlights for 2022 have really seen us as Grassroots Soccer launching our signature mental health promotion program, establishing this program in 5 countries, including Kenya, Mozambique, Scotland, South Africa, and Zambia, and securing these strategic partnerships alluded to by Benjamin with ministries of health in Mozambique and Kenya, where not only are we just taking the programs to the countries, but we're co-developing and scaling MindSKILLZ through schools and communities and health systems, where we've seen also this 96% reduction in clinically significant depression symptoms. And really, this speaks to a moment to just take a second to give props to our director of programs for global partnerships, for whom the work and the engagement and the linking and the working with the global partnerships manager in Kenya and LVCT Health would not have been as possible without her passionate work in working with partners and in working with government and in working particularly in our specific skill of technical assistance and our mental health technical advisor, who has been instrumental in really bringing out this mental health strategy that GRS launched in 2022. Next slide, please. So for anyone interested in reading more about all the other work in the different countries and more specifics around that, you can, with your phone camera, access the QR code and access our mental health impact report for 2022, or through the QR code, access our GRS mental health page. Next slide, and back to you, Benjamin.
Thank you so much. Once again, Charmaine has given us great insights there. We are going to now focus our attention, shift the focus a bit to the incredible work happening in Kenya. And Stella is going to guide us through the adaptation and implementation process of MindSKILLZ within LVCT Health, and probably just mention a bit about who is LVCT Health. Thank you.
So, good afternoon, everyone. Thank you, Benjamin. My name is Stella Gitia, and I will be taking you through what work LVCT Health has been doing in terms of implementing the MindSKILLZ program in collaboration with Grassroots Soccer. LVCT Health is a non-governmental organization. It's a local non-governmental organization that is based in Kenya and has been working in Kenya for the last 20 years. We are working in around 33 out of the 47 counties in Kenya. And one of the things we are doing is ensuring that the youth of Kenya are able to receive comprehensive health information through the most friendly and acceptable ways. And MindSKILLZ happens to be one of them. We have a robust youth program known as One-to-One. And through One-to-One, we were able to have this collaboration with Grassroots Soccer. And one of the things that interested us is that when we were offering other health services, including HIV prevention and treatment, SRH, gender-based violence services amongst our youth, we realized there was a gap in terms of their mental well-being and we really did not have something that we could offer to them. So MindSKILLZ curriculum came in handy, and I'm going to take you through the process that we went through just to start off the program and where we are at now. Next slide. So we are implementing the MindSKILLZ project in 2 cities in Kenya, that is Nairobi City and Mombasa City. And we have worked on this since November 2022 on a pilot phase, and we are going to end the pilot in March 2024. We are looking at reaching adolescents aged 10 to 14 because we all know that most of the mental health issues begin at this age. So we really need to equip our young people so that they are able to navigate their futures through a preventative youth-led approach. Next slide. So I mentioned we started off in November 2022, and we started off with a project contextualization meeting, and where we had all our stakeholders. Our main stakeholders are the Ministry of Health and the Ministry of Education, where we held a meeting just to discuss what that means for us, what is going to be our implementation framework. And one of the stakeholders that we really engaged are the young people. As LVCT Health, I mentioned we have a robust youth program. So we had already identified AYP, or adolescents and young persons mentors, working within other programs and other interventions, who are quickly able to come in and sit with us in the workshop to tell us exactly what it is that would look like, and just to ensuring that we are meaningfully engaging the young people. In December 2022, we had the stakeholder meetings with the county governments to introduce the program at the county level, and this was very well appreciated, and especially because of the gaps that I had mentioned of there not really being an intervention for mental health among the young people in the country. So in March 2023, we were able to recruit the coaches and train, and the coaches whom we recruited both in Mombasa and in Nairobi are young people who have been working with us in our youth program, had shown interest in supporting the youth, and had been working as mentors amongst various other programs. So we trained the coaches and they graduated, and we started the implementation. So in May 2023, we had a lot of sensitization for the coaches, and especially on data collection, because again, data is key. We are using the RedCap application to collect data. So each of the coaches is able to use this, and they were taken through that. We also had to seek approval, ethical approval at various levels, just to ensure that whatever we are doing is ethical, and every data that is collected is going to be handled ethically. Next slide. So to continue with what we've been able to achieve so far, we have continued supporting the coaches, because we always say and agree with grassroots soccer that the core are the coaches, and if the coaches are not well, then the whole program may not really be useful. So we ensure that the coaches are visited very regularly and are able to be supported, and we've been doing this as LVCT and also jointly with the grassroots soccer team, just to ensuring that the coaches are visited and are supported. And we've continued building the capacity of the coaches through the Coaches Academy, where we've identified different topics where the coaches are taken through, to include other issues, not only that are related to mental health, but even issues on how they can have money skills, how they can use their money better, how they can improve on their relationships, and even supporting them in development, career development, probably how do they even prepare their CVs, because again, we are looking at them as the leaders of the future, so we need to keep working on them and building them. So we have been able to have a cohort that has graduated. We graduated our first cohort in August 2023, and it was really memorable occasions as the children were able to tell us what they have learned from the MindSKILLZ sessions, and them just exhibiting progress and growth, some of them with very exciting experiences, and some of them even being able to identify some of the growth that the MindSKILLZ sessions have given. Some of them were even able to identify performance improvement, and some of the teachers were also able to provide feedback on how the children have moved from very withdrawn children to children who are able to speak out their mind. And so we continue to also do the evaluations during the sessions with the research team, just to ensure that we're able to collect data at the beginning of the sessions and at the middle and towards the ends of the session, just to ensure that we're able to track the progress of the children. So we continued with the coach visits and the support for the coaches in the month of October. And the coaches have also come out strongly with some of the areas that you still want to be supported through. And one of the things that we've done as LVCT Health is to utilize our digital platform, which is known as One-to-One, which now helps the coaches get more information, and especially on mental health and other issues that may come up from the adolescents that they are working with. And they are also able to be supported by the psychologists who work in the One-to-One call center, who are also youth psychologists, to address some of the issues that they are experiencing. So the One-to-One has really been of great help in terms of support, information seeking, and also being able to provide further guidance and further information and referrals for the coaches who probably need more information before referring the clients. In terms of psychological support, we've been having debriefing sessions for the coaches with our psychologist, who is able to also address any psychological issues that may come amongst the coaches in group sessions and sometimes even on one-to-one sessions. Next slide. So for us, our next steps and what we are looking at, even as we come close to the end of the pilot phase in March, is evaluation of the projects, just to see what are some of the lessons that we've learned and can be used for scale up. Of course, documenting the best practices. We have looked at how do we develop abstracts, how do we develop even documentaries, just to really build and document on our work. And we are looking forward to hosting a regional mental health learning exchange forum early next year to disseminate our findings from our projects, and also to really improve or add on to the existing knowledge in terms of adolescents' mental health. And we continue also engaging very well with the coaches. And so we are hoping to also have a best practice forum for the coaches where they can come, interact, share, and learn from each other. Next slide. So I spoke about our support from the Nairobi County government and the Mombasa County government. And we also have a code that you can scan and just get to the One-to-One digital platform. But again, this is for young people below 25 years. So the information that is there is targeted for young people below 25 years. And the information in the One-to-One digital platform is made by the young people, for the young people, with a lot of consultations in what is trending amongst the young people. So our team works very closely, getting a lot of feedback from the young people. And the coaches have come in handy because they are able to provide real-time information on real-time feedback on what the young people are going through and what the young people are looking forward to hearing or looking forward to learn. And that's the end of my presentation. I want to appreciate all of you for attending this session, and thank you. Back to the moderator.
Thank you so much, Stella. That was quite great and clear. We can already see what has been happening on the field since November 2022, all the way to where we stand now. And so, are there any thoughts? Kindly just feel free to share already on the chat. We'll also be having a time for sharing, question and answer at the end. And so feel free as well to engage us. We are going to get one of our coaches, our second coach, who is going to be showing us how MindSKILLZ builds essential coping skills and emotional regulation strategies. And so let us get ready yet for another engaging session. Coach Umi, take it away.
Thank you, Benjamin. So, hi everyone. My name is Umi Said. I come from Mombasa, Kenya, and I'll be your coach for this session. Feel free to ask any questions that you may have, and also feel free to just engage. And just know that we will treat this session with the utmost confidentiality. So welcome. So I would just like to ask, how are you feeling today? And you can just use an emoji or one word to describe how you're feeling today. Quickly in the chat box, kindly. How are you feeling today? Just use an emoji or one word. I see that people are quite excited. Charmaine looks a bit worried. Okay, Tanis also looks a bit worried. So I hope after this session you'll feel better. So let's get started. We're going to do a small activity. It's called take a stand. So what take a stand means is that you decide, you either agree or disagree. I'm going to give a statement, and then you will tell me, according to what you think about the statement, you have to either agree or disagree. So the statement goes like this. I think we will use the thumbs up for agree. Again, we can just use the chat box. Thumbs up for agree and thumbs down for disagree. So the statement goes like this. Adults are more stressed than young people. Adults are more stressed than young people. You can give me your responses through the chat box. I see that Kaniz has shared an answer, thumbs down. So Kaniz, would you kindly be able to share why you've chosen disagree?
Yeah, thank you for the opportunity. I think it's mostly to do with the immediate environment and also our own response to the immediate environment, which might add or not add to worry. Also, I feel as an adult, you have perhaps learned to cope with your environment much better.
Okay. Thank you for that. Oh, sorry. Are you done?
Yes, please. Thank you.
Okay. Thank you for that. I'm seeing Mildred has chosen hands up. So Mildred, would you be able to tell us why you've chosen that particular response? Mildred? Okay. Okay. Then I've seen that everyone else has just chosen disagree. And again, this statement is just how you perceive it. Again, adults can be stressed as well as young people can also be stressed. So we will learn to know how to better deal with our stress in the next section. So up to this point, we'll just send a link to the chat box. It's a link to a Jamboard whereby we will have a question, and the question goes, what does stress mean to you and what do you do to deal with stress? So I would like each individual to just briefly tell me, what does stress mean to you and what do you do to deal with stress? For example, you're stressed, so what do you do to ensure that the stress reduces or the stress is no longer there anymore? So the Jamboard link, Or maybe we can also just use the chat section as well as we wait for the Jamboard link. So just tell me briefly, what does stress mean to you and what do you do to deal with stress? I'm already seeing responses from Polly. Polly says, pray, sing, go to the driving range and work balls. What does work balls mean? If you don't mind sharing kindly. Oh, okay, hitting golf. Or I've learned a new word. So Canis also says, stress is when I am unable to think of a solution to a perceived problem. Thank you for that, Canis. And Faith says, stress is a state of mental strain or tension. Thank you for that, Faith. So 2 more people to tell us what stress means to them and what they do. When you experience in your body that which is in your mind, agitation, heart racing, chest pains, and panic attacks. Thank you all for your responses. So basically what stress means according to MindSKILLZ, stress is our response to pressure or threat. Stress is the feeling that a person gets when you feel that you are in a moment of pressure, when things have come to you all at once and you do not know what to do. And also again, you feel like you're not able to give back how you're expected to. So what most of the times people fail to look at, especially young people, is that stress is a normal part of life. But again, being stressed for too long is not good because it again starts to be harmful. So I have seen that you guys have also mentioned some of the things that we feel when we're stressed, like heart racing, chest pains, and panic attacks. So some of the things that we do, I have seen that we have talked about working balls here. We've also talked about playing and stuff like that, singing. So basically, what coping skills are, these are things that a person does to deal with difficult and stressful situations. So coping skills are things that a person does when they feel like they have a lot on their mind and they need to reduce it. So in coping skills, we have the healthy coping skills and we have the unhealthy ways of coping. So some of the healthy things that we may have, you can relax your mind and your body through dancing, singing, and also doing exercises like working balls. You can also just talk to someone that you trust because some of the times things may overwhelm us. So we need to talk to someone that can listen to you because just releasing whatever you have is a good form of coping. You can also make a to-do list and prioritize things that you need to meet a deadline. So for the unhealthy ways, I know some of us know about drugs and maybe drinking alcohol. So these are also ways of coping, but again, they do not per se do coping because they just make you forget about your problems for a short while. But in the long run, they have effects that they bring to your mind. So generally, we are encouraging you as young people and also senior young people to just ensure that you follow the healthy coping skills and ensure that you do not stay in stress for a long time. And again, if you feel like the stress is becoming a lot for you, you can always call 1190 and just talk to a counselor. And if you're not able to call, you can just go to one-to-one website and also just get more information on mental health on that part. So thank you for everyone who has participated. That is the end of our coping skills session.
Thank you so much, Coach Umi. You have made sure that first we understand what stress is, all the way to how do we deal with it. And so I think it would not be fair if we wind up this session without hearing it from the participants themselves. And so here we're going to hear directly from the participants and some of the government partners. So here are some powerful video clips showcasing the experience. Someone has unmuted. Kindly mute as we go to the video clip.
As a coach, in coming to engage with the participants and also the curriculum, I've used some of the practices such as the 3Cs to deal with my anger issues. Also to the participants, the program has impacted them a lot because it has created the awareness of some of the places where they can go and seek the psychosocial support in case they're facing any challenge related to mental health.
Personally, it's built me emotionally because listening to these kids and being their anchor in their time of sadness and giving them an intervention on how they can cope up with their life, relate with their friends, it sort of puts you in a place where you can actually sit, reflect about yourself and emotionally balance yourself.
It was a great experience. Right from me as a coach, I've been able to interact with the community, something that I've never done before. With the adolescents and the young people that we're dealing with, MindSKILLZ has actually helped them to be more aware of themselves, boost their self-esteem, and enable their power of choice.
The program has given me a chance to have some strong bonds with the community stakeholders, the participants and their parents. It has given me skills to be able to identify the mental health challenges that the participants might be going through.
Before this program, I was feeling depressed. I was feeling anxiety, and whenever I felt those, I did not know how to help myself, how to do whenever I'm in that condition. But after the program, I learned Tech 5. So whenever I feel depressed, whenever I feel that I'm stressed, I'm low, I do the Tech 5, and it helps me a lot.
A program like this deserves more credit because it has never been at the community, engaging young people. One thing that is very unique about this project is the issue of diversity. The project has been very diverse. It has been able to capture, also the people with disability.
Yeah, my name is Kennedy Micheni. I'm the sub-county mental health coordinator, Changamojombu. And I'm very happy because of MindSKILLZ, the work the coaches have been doing in the community to assist our children in coping mechanism. Even in the community, they are talking positive about the entire project. MindSKILLZ, it's a good project, and I wish it can be scaled up so that we can.
My name is Jabez Juguna. I am 14 years old. I study in Daniel Komboni Primary School. Before MindSKILLZ came to our school, I was unable to manage my stress. and magazine has helped me to know the power and different things in my life that as a junior secondary person I could not have understand. If we could have another session next year so that I can learn more again, so that I can share to my friends.
And what I can say about this program, it's a very, very important and useful program to these kids because I have actually seen changes both in my participants and both in myself. I'll first talk about myself. So there's this time I was going to an interview and I was late. So I was actually anxious that I was going to miss the interview and I was going to mess it all up. But in MindSKILLZ curriculum, there's something we call Take 5. So Take 5 basically involves you taking 5 deep breaths, breathing in. It helps you relax your nerves, calm down, and focus on the goal.
We are just seeing the curriculum working, speaking to the adolescent, making sure that they are grasping the information which was written to the curriculum and they identify with it. And just bringing ourselves down to that level of maybe just 10 to 14-year-old child, the inner self. Bringing yourself there makes you understand all the traumas, all the problems you are encountering, and just healing, accepting that yes, it happened. So throughout the process, as you are helping the adolescent, you also help yourself, whereby you are reflecting on yourself.
Thank you so much for that clip. I am sure that all of us are already starting to see what it means to be running MindSKILLZ in your community already. And we are presenting to you something that has worked, something that has added value greatly to our community. Right now, I'll be engaging briefly with one of our coaches and another. And we'll get to hear briefly around what were their greatest insights, what was your greatest highlight through your coaching. And so I'll start with Zekia Magero. What would you say has been your greatest insight as you have gone on with the coaching?
Thank you so much, Benjamin. And probably just to mention, I would say through the entire journey, working or supporting the adolescents, I've been able to understand that there are a lot of things that adolescents go through, and probably having a space where they can just speak of the things that they are going through or experiencing is important for them, because creating a safe space, MindSKILLZ has been able to be there for them, and probably getting to understand why they need the space and being able to speak about themselves. Because being aware about yourself, being aware about your personality, your insights, you're in a position to understand that as an individual, as an adolescent, there are far much better things in store for you, and you have the ability, you have the willpower, and it's a matter of just tapping into the potential of these young adolescents and being able to support them once they've been able to identify some of the things that they're good at, and probably nurturing or fostering good morals in the community. Because for MindSKILLZ in the community is working, and we are having kids who are willing each and every day, new kids who want to join. And as to us as coaches, as to me, I've been able to understand that it is important to just avail myself for the young people, for the adolescents, whenever need be, because the safe space is what they need. And once they identify with you as a coach, then it is with you that you can support them and uphold whatever it is they think to be within them in terms of their potential, in terms of being able to nurture their abilities as well. Thank you so much, Benjamin.
Thank you. Thanks, Zekia. Umi Omar, could we hear as well what are some of your insights, everything that stood out for you in a snapshot?
So for me, I think from the start, Everything has just stood out for me from the support that we've been getting from LVCT. They're always ensuring that we are able to deliver this program effectively, and they also do debriefing sessions for us, because most of the times we may get these things from the ground and we may not have an output for us to give to. So LVCT does these debriefing sessions and they help us to just share back whatever we've gotten from the ground, so that we are able to also deliver as coaches. And then again, in this program, what has also stood out for me, being part of a coach that was training adolescents with special needs, that felt like a good thing for me, because most of the times these young children are always left out in programs, because most of the people feel like they are really hard to work with. But again, in MindSKILLZ, I have learned that they're actually the most sweetest people to work with, because again, they also have a lot of problems that they're facing. They have self-stigma. They also have stigma from the community. So all of these challenges are just there in their heads and they don't have anyone to share with. So under MindSKILLZ, we were able to go and learn from them, and also just ensure that their minds are healthy for them to have their good mental health well-being. Thank you. I think that's it.
Thank you so much, Coach Umi. For all our participants, probably as we continue to engage, there's a poll that is on your screens. You are able to pick one or two answers. Kindly just go through. It's only 3 questions, and I'm sure that they're going to be useful to all of us as we look forward towards implementation of such programs. We are going towards the end of our conversation, and so we are going to open the floor for questions that may be coming from the viewers. Every person has an opportunity to get to ask questions. What was difficult, what was, what are some of the challenges and such. So kindly, just go through the poll and submit. But then just as a way of closing, Zakia, would you tell us what is the one thing that you would share that you've learned as you've engaged these young people? Something that you probably had not thought about, but starting engaging these young people, you started thinking about it actively. What would that be to you? All right, thank you. I hope everyone has been able to go into the poll and share. At the end of this session, we'll of course be able to share the results. Let's get to any of the questions that may be coming up from our viewers. Feel free to write on the post, or as well unmute and ask the question, and we'll direct it to the right person to answer. Okay, one of the questions is, what is the level of training and supervision that you feel the coaches require? Also, did you find that the coaches also needed some psychosocial support as they were implementing the program? I would ask Charmaine to respond to Paul Walker's question.
Okay, thank you very much, Benjamin. I think for me, I'll answer the second part of the question. You are best placed to answer the first part on supervision. But yes, psychosocial support is a big part and a big core element of caring for our carers being the coaches, because with mental health support, and as you saw from the video, participants telling you about challenges they're facing, stress they tend to face, as somebody, as a near peer, and as a coach delivering the programs, you do often sometimes experience what you call caregivers fatigue, the drain and the strain from having to be the one that listens to people and be there for them. So yes, indeed, coaches do need psychosocial support as the program is being implemented. It is why it is very great that we're working with a partner like LVCT Health, who in-house have mental health professionals such as psychologists, counselors, etc. So they ensure that coaches have debrief sessions occasionally, frequently, I mean, to make sure that they're checking in with the coaches, to make sure that they themselves aren't taking strain from providing support. They have a lot of systems in place to make sure that the coaches provide the support they need to be able to support the participants, but also as well to be able to support themselves. But Benjamin, if you could, from your experience, answer the first part of the question, which is looking at, the level of supervision and training that you feel from your experience coaches require.
Great. Just before I go, I'll ask Stella to go forward, and then probably if she needs anything, I'll be able to share.
Thank you. Like I mentioned during my presentation, is that the coaches are young people who have been working as youth mentors in different capacities and in different programs. And some of the things that we were looking at is someone who is passionate about mentoring the young people. And one of the things that really came up strongly is that they demonstrated the passion, and they also demonstrated the desire to make a difference within their community in terms of supporting the young people. Most of the coaches we have some background training in community development, in social work, in other social sciences, from all levels, at certificate level, at diploma level, and even at degree level. But for us, the most important thing was the passion and the desire to mentor the young people. And in Kenya, we have what we call the Youth Advocates Champions for Health, which is an umbrella body that works with the young people. So young people who are in different community groups come together to be members of the YAC. And then the YAC now is the one like really spearhead the activities for the young people and working very closely with the Ministry of Health. So that was our point where we were really looking for the coaches. Most of the coaches were members of the YAC, so they had already demonstrated passion and interest.
Wow, thank you. That comes in handy to answer the question. I think I would not do better. I hope that's clear. Let me ask, Charmaine also has something to add as we go to the next question. Charmaine.
Yes, so Polly and Ian, this should answer both your questions. So as Stella alluded to earlier, that coaches are central to our work. So when a coach becomes a coach, the first key thing is that they go through a training to be able to deliver the curriculum. It's about a 5-day training, sorry. They go through a 5-day training to be able to deliver the curricula, but their training doesn't end there. Because coaches are central to the work, we value their development. So their development process starts from the day they become coaches to the day they leave. So they have that 5-day training to be able to deliver the curricula. And then they have what we call coach support visits, where trainers and other members of staff visit the sites where the coaches are delivering the interventions and watch them deliver the interventions and provide them additional key supports on what they could add on to or other key challenges they would have questions about. And then also, again, they also have key structured debrief sessions, depending on the country where it's being implemented. In sometimes it's quarterly, but most of the time it's every month, where they debrief with either a counselor or a mental health professional or someone in staff, where they talk about any challenges they face delivering the intervention or any needs that they have. And then those key focal points, such as staff members, such as mental health professionals and counselors, will then refer coaches to specific key resources and key people. And then we also have what we call Coach Academy sessions as well, where these sessions give coaches life skills themselves. They give coaches development in terms of learnings around mental health, around other key topic areas, around in general also professional development. So there's multiple avenues and checkpoints and key individuals that that coaches interact with as they go through the journey of being coaches. So there's a very structured process of support, because our coaches are key and central to our work, because there is no better person to speak to young people about mental health besides another young person. Back to you, Benjamin.
I think that's quite eloquent. Thank you, Charmaine, for the great work, and Stella. Someone has, someone had unmuted. Thank you. We, of course, have a quite interesting way of dealing with these things, because as issues are emerging, then we are working on the next topic that we are supposed to be engaging when it comes to the Coaches Academy. So it's one of our greatest assets that we have. Then there's a question that has been asked, and I think Charmaine and Stella have done great to respond to it. Where do the coaches seek psychosocial support, considering that they offer individualized support? And so get caregivers, fatigue. And so that has been well answered as well. I don't know if we have any other questions from our different other platforms. If there is none, I think we will be able to see the poll results. For the first question, in your experience, what type of stakeholder engagement has been most impactful in your mental health programs? And we see community organizations taking the day, followed by educational institutions and then government bodies. And then the second question is, which aspects of the MindSKILLZ program do you find most promising for addressing mental health needs in adolescents? Integration with existing programs. And I think this is something that we totally agree with. Integrating mental health with the existing different other programs is going to be one of our most important directions for us to go through. And so probably we'd be thinking about how would you be able to integrate MindSKILLZ in your different programs that are going on. Of course, there is engagement with community gatekeepers, which is also having quite some good percentage at 68%, and then data sharing protocols. And our last question was, how do you think similar collaborative approaches can be applied in your own projects or initiatives? And we are seeing, again, integrating with existing services, taking the day, followed by partnering with community groups, as well as engaging local government offices. So we are seeing a lot happening and being pushed back to the communities, so that our communities and what we call primary care becomes our greatest focus as well. I would want to appreciate every person who has taken their time really to be part of this engagement. The conversation has been great, and we just want to appreciate each one of you for being part of this. Thank you to all the panelists. Thank you for Grassroots Soccer, the team that has been working behind the scenes, Devin, Ilana. We totally appreciate you. Thank you for our partners, the Government of Kenya, Ministry of Health. Thank you to the different county arms that we have worked with in Kenya. Both the government of County Mombasa and the County of Nairobi. We are appreciating a lot of the partners that we've been able to get. Some are children's homes that we've had, some are schools, some are community-based organizations. We want to appreciate all of you. And so thank you so much for joining this session. Probably we would want to, as a way, just before we leave, would we take a survey kindly? There's a survey on the chat. There is a survey that is very brief, and would want just some feedback on this session. Tell us where you think would need to do better in all. And so kindly just take that survey as a way of as well bettering our presentations in our coming future. And so once again, let us all make adolescent mental health something that everyone is going to be talking about. Thank you so much. Kindly let's go to the survey and take the survey. It will not take us long. It's a short one. And then I'll give us 2 minutes, and then after that, we will be actually 1 minute, because we are 1 minute to our time. So thank you again. Have a great afternoon. I don't know from where you are. Have a great day or night. Thank you so much once again. After you take the survey, you'll be free to leave the session. Thank you.